Thank you so much for joining us today. My name is Jinny Tavee, and I'm a neurologist at Northwestern Memorial Hospital at the downtown campus. I'm also an associate professor at the Feinberg School of Medicine. I specialize in nerve and muscle diseases, and today we're going to be talking about peripheral neuropathy in the setting of cancer. Now, if you do have questions, please feel free to post them in the comments, and we will be sure to answer them as best we can if time allows. So first of all, what is neuropathy? Neuropathy is a disorder of the nerves, usually in what we call a glove stocking distribution, meaning you'll start to have numbness and tingling in your feet that slowly can come up to your knees. And if it gets to your knees, it can also get into your fingers and your hands. Most patients report pain, burning, numbness, tingling. It's like walking on a sunburn. Or I've had some patients tell me it's like hot lava on their feet. Now, a few patients will have difficulty walking, and that's because they can't feel the floor or because they may have a little bit of weakness. Weakness is usually mild. In most cases, you'll feel that you can't grip things with your toes. Or in more severe cases, patients won't be able to pick up their feet, and so you'll have what's called a dropped foot. And so you might trip over things. But by and large, sensory complaints, meaning the pain, the numbness, and the tingling, are the most prominent symptoms. Now, I do have a number of patients who tell me that they can't stand having the bed sheets touch their feet at night. This is such a common complaint that we use it in research studies as an outcome measure. The symptoms are usually worse at night when you're lying in bed or when you're sitting down and watching TV and you're just resting. When we're up and about, sometimes we don't notice it because we're busy, but other times, if you've been up on your feet all day, you pay for it. It really hurts towards the end of the day. I do have some patients who have it throughout the entire day, but by and large, in the evenings is when it's worse. Now, how do you make the diagnosis? Well, first of all, chemotherapy, unfortunately, although it's life-saving, is also toxic to nerves. Specifically, things like Velcade for patients who have multiple myeloma, the taxanes like paclitaxel, platinum-based compounds like cisplatin, and of course a medication called vincristine, which is also known as Oncovin. These are very toxic to nerves. But again, they're life-saving, so it becomes this risk balance that you and your oncologist will have to discuss together. I've had a number of patients where the neuropathy became very severe, and that caused the oncologist to reduce the dose or give the patient a break. But you'll have to really talk about what's necessary for your cancer treatment. When patients come to me with the neuropathy, it's not a surprise, it's the chemotherapy. So my job is not to tell them, well, you have chemo-induced neuropathy, thank you. But what I want to do is to make sure that there are no other causes contributing to this, because that can make the neuropathy even worse. Now, neuropathy outside of cancer is quite common. It affects over 25 million people in the U.S. So we look for all those causes in cancer patients. And the number one cause worldwide is diabetes. And so if patients have diabetes, we have to get on top of that. Otherwise, it'll be very difficult to heal. The second cause may be alcohol, and so I'll tell patients, while you're recovering, if you can refrain from alcohol use, I would do so. But most commonly in my chemoneuropathy patients, I'm seeing B12 deficiency. B12 deficiency is actually quite common over the age of 60. The number one cause of B12 deficiency is a lack of gastric acid or acid in your stomach, because you need that to absorb the B12. Now, for a number of cancer patients, it might be you've had radiation in the area or surgery, or you have to be on medications to block the stomach acid. One of them would be something like omeprazole, that's also known as Prilosec. And these medications block the stomach acid that you need to absorb the B12. Another medication would be metformin for my patients who have diabetes. This blocks it through another mechanism, but B12 deficiency is something we have to look for in these patients. Supplement them. I prefer injections, but you can also do the sublingual, meaning under the tongue. But the injections, I think, are absorbed better. But these things can make you feel better. And I've actually had one patient who had testicular cancer, and we found that he had a B12 deficiency, and he was also drinking a little bit. And so we stopped all of those things. We supplemented him, and he did great. So now, what do I do to make the diagnosis? What I'll do is the clinical examination, and sometimes that's all we need. And we'll do lab work to look for the underlying causes. In a number of patients, I may do a really fun test. It's called EMG, or electromyogram. What we do with this test is we shock you and we stick needles in you. I don't get many Christmas cards, but it does help me in some cases if I think that there's something a little bit unusual about the neuropathy, or if it's severe, if it's affecting the motor fibers. It tells me how long it's been going on, how severe it is, and it can tell me a little bit about prognosis, meaning is there evidence of reinnervation? Now, a lot of patients ask, am I going to be like this forever, right? How long is this going to last? Is this curable? Well, the good news is that most patients do better, meaning they do improve over time, especially when the cancer chemotherapy or other treatments have been stopped. However, to be honest, most patients still may have a little bit of neuropathy, although they can live with it and they can function with it and they're fine and they can do all the things that they need to do. A small number of patients, however, do have ongoing pain that persists. And so for these patients, then we need to do chronic pain treatments. However, by and large, most patients who have this, we try to get you through the cancer treatments with pain medications, and there are a number of them out there that are safe with chemotherapy. One of them is gabapentin. Another one is pregabalin, and there are many other medications that are typically used for seizures, depression, although it's not really for the depression, it's for the neuropathy. Those would be things like nortriptyline or amitriptyline. For the very, very severe patients, we can use pain medications like tramadol, also known as Ultram. And I've had a number of them have to go to a pain doctor to receive narcotics under a very controlled watch. Now, in terms of what I can do for you, I can give you the prescription, we can make the diagnosis, we can look for other causes, but there are many things that you can do as well. And the number one thing that I recommend my patients is nutrition. Eat nerve-healthy foods. Protein, protein, protein. Chicken, fish, lean cuts of red meat, fruits and vegetables. Doesn't have to be organic. I can't afford $5 a pound for apples, but whatever you can get is good. And of course, exercise. That's the second thing. Exercise is, for many of my patients, their saving grace. I don't care what you do, if it's running, walking, biking, Zumba, it doesn't matter. These things will help you overcome the neuropathy pain. Mind-body therapies. Mind-body therapies like Tai Chi. Tai Chi has been shown in a number of studies to be helpful for chemotherapy patients and diabetic neuropathy patients, to be helpful for both pain and balance, and also fatigue. Meditation, Qigong, yoga, if you like yoga, Pilates, anything that helps you get out of your head, because it's a lot, right? You have cancer, and so it's become, why me, why this? And then you get the neuropathy on top of it. So again, we need to get you out of your head. We need to get you thinking positively because, as I said before, you are going to get better. All right. Well, that's what I have for today. Please post your questions in the comments sections and I'll be happy to answer them.
Are there stages of peripheral neuropathy? And if so, what are the stages of neuropathy?
So there may be official stages, but the stages that I use for my patients is the degree of symptoms that they have. So the mild ones would be things that are just limited to your feet. Numbness, tingling, pain. Okay, that's considered mild. But if it starts to come up, if it's also in your hands and it's interfering with your day, that's a little bit more prominent, and so I would call that maybe moderate. The severe cases are when you have motor involvement, meaning your legs, your hands, they're actually weak. It's not because you're not dropping things because you can't feel them, which is very common, especially in things like carpal tunnel syndrome, but it's because you do not have the strength to grip things or you do not have the strength to pick up your feet.
You talked about the mind-body experience and dealing with neuropathy, and so it sounds like stress can worsen the symptoms of neuropathy. Is that correct?
Absolutely. And I tell patients, who have neuropathy, that you're like this fragile flower, and so we need to make sure you get enough sleep. We need to make sure that you're eating well. And yes, stress can make pain worse. It doesn't make the neuropathy worse. It just makes the perception of pain worse. If you're already having a bad day and you have to deal with the numbness and pain in your feet, you're going to perceive it a lot worse than if you're having a good day and you're surrounded by friends and family, you're doing fun things. So I do recommend reducing stress levels if and when possible.
And you talked about some of the chemotherapy agents that potentially can cause neuropathy. Can you review what chemos that we know are associated with neuropathy?
So as I said before, the platinum-based compounds, cisplatin in particular, are known to cause neuropathy. Platinum loves the part of the nerve that is in your back, and so it comes down and it affects the nerves called the dorsal root ganglia. But yeah, platinum is a notorious one. Oncovin or vincristine, Velcade is a very, very common one, and the taxanes. Those are the ones that I said before.
So this is a two-part question.
Mm-hmm.
One is, can chemotherapy dosing be calculated differently to prevent the neuropathy? And should a patient stop chemo treatment if the symptoms of neuropathy get worse?
So in terms of preventing neuropathy, I think that the primary goal of chemotherapy, of course, is to treat the cancer. So before they even do anything like that, I think that needs to be weighed, with the potential risks, because neuropathy isn't the only risk. So I would leave that up to the oncologist. But yes, there are some adjustments that can be made. Usually they want to be aggressive at the very beginning. Now, in terms of stopping the chemo, as I said before, I've had some patients when the pain is unbearable or they display very strong symptoms of marked weakness, meaning they can't pick up their feet. We do usually recommend stopping, giving the patient a break, or reducing the dose. But again, that's a decision for you and your oncologist.
Allison Z is asking, how do I know if the pain in my feet is neuropathy versus a side effect of tamoxifen? She mentions it's worse for her in the morning when she's getting out of bed.
Mm-hmm. So, tamoxifen is not well known to cause neuropathy, but I wouldn't be surprised if it did. It depends on the timing, meaning if the neuropathy started around the same time you started the tamoxifen, afterwards, not before, then that's a potential risk factor. And you also, again, as I said, you want to make sure that there's nothing else that could be contributing to neuropathy, like diabetes. Thyroid disease is another one. Autoimmune conditions like lupus. An allergy to gluten, which is a protein that's found in wheat, can cause a neuropathy. So it's making sure that everything else has been excluded or ruled out, and then trying to time it with the medication.
Lots of questions about alternative treatments or therapies to decrease neuropathy. Is acupuncture or other options Do you have any recommendations?
So that's a great question, and I have a special interest in complementary and alternative medicine. Just to answer your question right off the bat, acupuncture, I think it can be great for many other conditions, but in the setting of neuropathy, I haven't had much success. I recently did a cancer support group talk a couple months ago with some patients who are cancer survivors, and they were talking about how acupuncture didn't help for them. But what I do recommend is there are a number of supplements that have been shown in very small clinical trials to be helpful for neuropathy related to chemo. One of them is called acetyl L-carnitine. Another one may be alpha lipoic acid. Let's see, frankincense oil, not gold, not myrrh, frankincense, but Vicks VapoRub, horse liniment cream, Tiger Balm. These things can really help a lot of patients because you don't have to take it, you just rub it on your feet. And then, of course, there's medical marijuana. A number of my patients have found a lot of benefit from that. And then you don't have to eat it. Again, I have a 93-year-old who puts the CBD oil on her feet. She loves it.
What other pain medicines did you mention besides gabapentin that might be beneficial?
So gabapentin, Lyrica, nortriptyline. It's an antidepressant that was used in the 1980s. We don't use it for that as much. Amitriptyline, it's a little bit more aggressive than the pregabalin. I'm sorry, it's a little bit more aggressive than the nortriptyline. Those are my four first choices for pain medications. Lidocaine cream. So you know when you go to the dentist office and they give you Novocaine, lidocaine is a sister drug, and it comes in a sticker, it comes in a cream, and you can put it on there. Other medications would be tramadol. It has a potential for addiction. It's not a narcotic, but it acts like a narcotic. And so you do have to be careful, but I like that for my patients who work because it doesn't make you so dopey. A lot of these medications do have side effects. You know, for instance, there's a medication called topiramate, also known as Topamax. We call it Dopamax because it can make you a little sleepy and dopey, but it does help, you know, that I've seen in my practice. This is not an FDA-approved drug, but tramadol or Ultram doesn't make you sleepy in most patients, and it just takes the edge off.
Alyssa's asking, she's taking medication that's causing her diabetic blood sugar levels to rise, and she's having some hand pain. When she stops this medication, and her blood sugars return to normal, will this go away?
Potentially, yes. I mean, if it's chemo related, yeah, because as I said before, you're looking for any other potential causes, and I mean, as she's living it right now, the sugars are making it worse. So it's very possible.
The other question that came in from Sandy is she mentioned she's having her neuropathy worsens when she's walking outside in human conditions, and is this normal?
So as I said before, sometimes if you've been walking for a while, you will feel it. But the other thing is weather conditions. So as I said before, you are now a fragile flower. So extreme temperature shifts. So the worst is cold. Cold is not your friend. And for all of our patients and friends who live in Chicago, I'm sorry. But what I do recommend is to get out of the city when it's really cold. If you can, you know, go to Florida, go someplace warm, Phoenix, even if you just can go for a weekend, just to reset your body. Heat, extreme heat, can also be irritating to the nerves as well. Again, it's not making the neuropathy worse. It's just making your perception of the neuropathy worse.
And I think you answered this, but I'm going to revisit. Diane is asking, she's had neuropathy for the past 2 years, and she recently stopped taking gabapentin. And she's wondering, with the medical marijuana, if that would provide some relief. She did not find gabapentin. She mentioned it was awful for her.
Yeah, no, and as I said before, a lot of these medications have terrible side effects. I mean, if you are doing well with gabapentin, great. I like it because you can't kill yourself with it, right? And it doesn't interfere with the other medications. But some people just can't tolerate, even in low doses. It makes you dopey and sleepy and fat and tired. So in a number of patients, medical marijuana has been shown to be helpful for the neuropathy. One of the reasons why may be because you have receptors for the medical marijuana. So there are over 100 compounds in marijuana, and one of them is called CBD, right? And so the CBD receptors are actually on the peripheral nerves. So then when you're taking it, I never recommend vaping or smoking it. We do not know the long-term complications in cancer patients, especially if you have lung cancer. But if you do, like the topical, or if you do, gummies, that may address the CBD receptors on the peripheral nerves. You're going to have to really it's not going to be something automatic. You're going to have to, figure out what dose works for you, what method works for you. But it comes in chocolates and gummies and espresso beans. It even comes in butter. There's CBD butter that one of my patients puts it on her toast, and she eats it every morning. And I joke around. I said, well, what if somebody else gets into that butter, right? They'll be like the best toast they ever had. So
I think that was the last question we had.
Okay, well, thank you so much for joining me today here. And please stay tuned to Living Well's Facebook page for cancer-related issues.